Dystonia is a movement disorder, the third most common after Parkinson's disease and essential tremor. Its name is redolent of music. The Greeks used tonos to mean a rising pitch. Here, however, it refers to an abnormal tension in muscles causing deformed postures. Dystonia is in essence merely this, an abnormal contraction, but its color and variety leads it to affect both young and old, male and female, the muscles of the neck, hands and feet, and writers, dancers, and musicians. My name is Owen Killian, and I am a medical student currently pursuing research with the Irish Dystonia Research Group in St Vincent's Hospital and Trinity College Dublin. My work centres around two main questions. Why do musicians with dystonia perceive certain stimuli differently from those with other forms of the disease? And what changes can be seen in the dystonic brain? The first of these involves asking musicians to look at pairs of flashing lights and assessing their ability to perceive short delays between the lights. Previous research has shown that while most with dystonia perform worse on this task than healthy controls, that is not the case in those with musicians' dystonia. By asking healthy musicians to perform the same task, I hope to demonstrate that they perform better still. Thus, while musicians with dystonia may appear normal, they are in fact abnormal compared to other musicians. Such a finding will deepen our understanding of the capacity of the brain to process novel stimuli and adapt based upon certain activities, such as playing an instrument. In order to identify changes in activity in the brains of patients with dystonia, we invited patients, relatives, and healthy controls to undergo functional MRI. We can identify what brain areas are active during a particular task. During the looming task seen here, we expect the superior colliculus to be active. This area of the brain allows us to quickly focus our attention on a sudden visual cue. We compare this to activation seen during a receding task, which is visually similar, but does not activate the superior colliculus. The results of this appears to indicate that the superior colliculus is less active in people who do worse at the flashing light task. This includes those with dystonia and some of their relatives. Indeed, there is a relationship between how well one does at perceiving short delays between the lights and how active the superior colliculus is. It seems likely, therefore, that a dysfunctional superior colliculus is necessary but not sufficient for the development of dystonia. While this research focuses on the neural mechanisms which give rise to dystonia, there is hope that by better understanding the causes of the condition, more targeted therapies can be developed to open eyes, straighten heads, and to once again allow writers to write, musicians to play, and singers to sing.